Hi, this is Dave Shern and News from National for April. What we'd like to highlight this month are the activities that are planned by Mental Health America in conjunction with Mental Health Month. May is Mental Health Month. During the Prevention Week of Mental Health Month, we're going to offer two webinars. The first will feature work that's going on in Manitoba, Canada by Dr. Dennis Embry and his colleagues, in which they're implementing a province-wide prevention program utilizing the good behavior game and other science-based approaches for improving health. I think it'll be very interesting to see that large-scale implementation of the known technology that we all know can make such a big difference in terms of community health and well-being. On the 24th, our own Bob Decker from Mental Health America of East Central Florida will present a webinar on his work with Live Your Life Well and taking our web-based program and repurposing it so that it's used with support groups and others who are attempting to better deal with and manage stress by using those tools. I think you'll find it very exciting, and we're certainly excited about Bob's work and the degree to which it may underlie our ability to more broadly disseminate the Live Your Life Well technology throughout our affiliate network. Additionally, we've prepared two toolkits that resonate to the two May is Mental Health Month themes. One is Do More for 1 in 4. That addresses the prevalence of mental illness and provides lots of helpful information about mental health and mental illness that can be used in general public education efforts and what you can do as an individual, as a community member, as an MHA affiliate to help address these issues. And then secondly, trauma and its invisible wounds, secondary theme for May is Mental Health Month. And here we provide information about the prevalence of trauma and its long-term effects, related both to the experience of our war veterans returning from combat that we hear about daily, as well as from the continuing emergence of information about people who've experienced early life trauma in terms of childhood adverse experiences and the degree to which that predicts really lifelong problems with both mental health and general health conditions. So those are May is Mental Health Month activities, and we certainly look forward to learning more about everything that you're doing in your communities on those themes and in other areas related to mental health. Finally, we'd just like to briefly highlight two activities that have traditionally been associated with our annual conference. The first is Capitol Hill Day, June 25th and 26th. We'll be joining with colleagues from the National Council for Community Behavioral Health, as well as from the United States Psychiatric Rehabilitation Association, which should be a very powerful show of force on Capitol Hill here in Washington. It's a very important time for us to be addressing these issues as the budget discussions continue and as at least some aspects of the budget continue to really target discretionary funding where many of the mental health programs are housed. So it's an important time for us to be here. It's great to be collaborating with our colleagues at NCCBH and USPRA, and I encourage as many of you as possible to join us in Washington the 25th and 26th. Registration materials are on our website. Registration is free. We have a great program on the 25th, and 26th we'll actually hit the halls of Congress, so we hope to see you there. Finally, as you know, our annual meeting this year is being held in Tulsa in conjunction with the Zero Mental Health Symposium. The theme is really beyond housing to community integration, a life in the community. We've received a lot of excellent proposals and have extended the deadline for submission of proposals through April 30th. So if you didn't have a chance to meet the earlier deadline, this is your chance to get your program featured at the annual conference. We've lined up some great keynote speakers, and I think it's going to be a terrific, terrific conference, and I encourage you all to submit your proposals and certainly to do all that you can to attend the meeting in Tulsa September 19th through the 21st. So that's it. It's going to be a busy May for a Mental Health Month. I look forward to seeing many of you on Capitol Hill Day and certainly in Tulsa.